Hi, I am Dr. Kevin Chan. I have two medical practices in Phoenix, Arizona. The first one is Foothills Family Medicine, where I do mostly primary care. My second practice is Regenesis. It is a concierge integrative primary care where I get to do a lot more classical Chinese medicine and acupuncture. The concept of Regenesis is to improve patient experience, improving care coordination by being patient advocates and streamlining the healthcare process. The national average for a physician encounter is 7.5 minutes after an average of 45 minutes wait. That frustrates me. You have to spend time with the patient, give them the attention. So that's the key for me to start looking into concierge medicine. Regenesis is the company that I created to offer concierge medicine through Signature MD. But as you know, most concierge physicians in the US, they only practice conventionally. And I felt like, maybe I need to do more. What do I need to do to improve the value for my patients? And then I say, you know what, let me add an integrative, anti-aging, functional medicine twist to it. And one of the things that I am particularly interested is to focus on arteriology, vascular health. I'm one of the few doctors in my area that focuses on non-invasive vascular testing, looking at their arterial stiffness, looking at endothelial dysfunction, because we know with endothelial dysfunction, it predicts heart disease by decades. So we have to check endothelial dysfunction. I look at the arterial stiffness through pulse wave analysis. Of course, I look at how their stress is affecting them through heart rate variability testing. And then finally, of course, I look at their plaque, abdominal aorta for aneurysm, and also for doing IMTs to look at plaque. And that gives me additional picture of other risk that is not present in a typical lipid profile. One thing I found that Chinese medicine offers is to look at a patient in a very different way that even functional medicine do not. For example, when we give therapies, some therapies are hot or cold in terms of its energetic nature. IV therapy with vitamin C. What is vitamin C? According to the principles of Chinese medicine, is cold. It's a cold herb. Well, what happens when you give a cold herb to a cold person? That person will not do well. In fact, he will get worse. And that's one way to explain why IV therapy is not benefiting everyone, especially some cancer patients. Think about that, right? So when we talk about, oh, you should use vitamin C to treat cancer patient. Well, how come some do better, some do worse? And therefore, vitamin C is not good. No, you have to know, are you giving vitamin C to the right person? So what I found is a delicate balance of combining IV therapies, which is cold in nature, with acupuncture, which is warm in nature. Again, it's like looking at Western approach through the Chinese lens. And I want to do all that in the context of improving arterial health. And that would have to include diet, exercise, nutrition, appropriate nutritional supplement, but on top of that would be a combination of herbal supplements and acupuncture. Because interestingly, we don't really have a tool in Western medicine to treat problems of the nervous system. And I think acupuncture is really the tool, perhaps the only tool to directly modulate the nervous system and its outcome. If you're interested to learn more about what we do, please go to my website and all the contact information will be there.